It has been a long time since I stopped and thought about why I entered the world of nursing, or more importantly, why I became a nurse. In my 21-year emergency nurse practice, it is sometimes hard to stop and think about when I decided to be a nurse. I will say a huge part of my influence was my mother. She is my hero, if such a concept exists, the image of who I strive to be like, especially in my clinical practice. A recently retired 46-year nurse veteran whose work has taken us as a family all over the country, from private sector hospital life to Indian Health Services growing up on an Apache reservation in Arizona, to playing with children hundreds of thousands of miles away from their villages and families in Alaska. She exposed my siblings and I to people, places, and cultures that are not of our own, allowing us to truly experience the saying, "It takes a village." The notion that everyone has to hang on and help each other up after falling in order to be successful. That it is not a one-man show, and that we are a team in all things in life, including marriage, raising children, work, health, and happiness. A belief that the team for each person can and will look different. Sometimes our team is people we don't know anything about, but who come together to serve a purpose. The greater commonality outweighs each person's personal or professional beliefs, or at least I believe they should. And in the world of nursing and healthcare at large, it is taking care of our patients. For all of those things, I am truly grateful for the building blocks that she instilled in me, for opening my eyes to the concepts of compassion, empathy, support, and education, and the notion of truly connecting to another human being, which led me to the caring of a 28-year-old man in our ED during the second surge of the Delta variant of COVID-19. For the purpose of this paper, I will call him Jose. Jose presented to our emergency department one weekday morning for complaints of shortness of breath. One of the nurses in the department was caring for him, and as a nurse manager, I was rounding on my team in the morning, checking in with the physicians, the nurses, and the clinical team for the day. As I made my way through the department, I saw a small crowd gathering outside of a room and decided to approach. I checked in with one of the nurses outside the room, and she told me that the patient Jose had tested positive for COVID-19 and that he had been progressively getting worse with his shortness of breath over the last hour. And more importantly, that there were discussions of intubating him as he was in distress and tiring out from his increased work of breathing. As I stood outside the signed COVID room, I saw a young 28-year-old Latin male who had the clear mark of fear in his eyes. His face kept shifting throughout the room, noting that his eyes were widening and he was sweating, likely from breathing effort, but more importantly, he was alone, with a group of people standing outside his doorway watching him. As a person with profound asthma, I know that look all too well. The feeling that you are under a microscope being studied and observed. The feeling of fighting for air, knowing that no matter how many times somebody tells you to slow your breathing down and focus on your breathing, which you of course are doing, doesn't help the situation. They are meant for words of comfort, but they are inadequate and hollow, comforting the person that is saying them as opposed to the person who is experiencing them. So I did what someone would do for me when I'm having an asthma attack and struggling to focus. I donned PPE and went in and sat at his bedside. I introduced myself both in English and in Spanish, asking which language he preferred I speak to him in. I told him not to speak anymore, that I would only be asking him yes or no type questions, and that he only needed to raise a finger for what he wanted. He voted for English, and I persisted to fill the airspace with distracting conversation, telling him about myself, instructing him to focus on one spot in the room, and that I did not care what he chose to focus on, but he had to commit to it. He had to commit to it with 100% commitment. He verbalized understanding and chose to look me dead in the eye and listen to everything I had to say. I talked about how long I worked for the organization, how long I was a nurse. I talked about my upbringing and moving from different states. I talked about my stepdad being from the Dominican Republic and that my significant other was from Colombia, but strangely enough, grew up in Connecticut. The entire time he looked at me in the eye, never wavering, and I committed to the same resolve. It is very difficult to look somebody in the eye and hold that stare. It inherently makes people uncomfortable. But it is something that I have done for years, and I wanted him to see truth behind the fear. The respiratory therapist came in to obtain a blood gas, and while she was explaining the procedure, he reached out and grabbed my hand. I held on tight, telling him that I would be here through it, hopefully comforting him and steeling my resolve for what was about to happen next, knowing in my mind what was coming. Once resulted, the ED physician came back into the room and reassessed him. All of the things a critical care physician would do with the skill of a hardened practitioner, and finally broached the topic of intubation in order to help him heal and give his lungs a chance to rest. I held his hand tightly throughout all this shared information, and while the troops were outside preparing for intubation, I talked to him, reassuring him that it was okay to be scared and that all of this was scary. He started to shake, ever so slight from fear, and it was my time to do what nurses do: comfort in the face of fear and advocate for his well-being. He turned to me with tears in his eyes and he asked me, "Am I going to die?" With tears in my eyes, I said, "Oh, Jose, I don't know the answer to that question. And to be honest, I don't think anybody does. But that we would all be fighting like hell to keep him alive. That he is critically ill and that the breathing tube and the machine might just be what his body needs to help fight COVID. But that there was a very real possibility that he might not make it out of the ICU alive. More importantly, that the ER nurses and doctors, and soon to be the ICU team of nurses and doctors, wouldn't give up until we were all backed into a corner with no way out and exhausted every treatment option." He nodded his head and appeared to find comfort in the honesty and saying what had never been said. As the tears fell from his face, and as I shed my own, I turned to Jose and asked him, "Jose, what do you want me to know about you before you are unable to talk because of the breathing tube?" He proceeded to tell me through gasping breaths over 20 minutes that he was engaged to be married, that he is loved by his entire family, and that he loves them in return. And then in another life he wanted to go into the seminary, but changed his mind as he got older. That he works on cars and was quite good at it, and that he's studying to be a mechanic at a large car dealership in Tampa. And that if he's not going to make it, would I tell his family that he loves them with all that he has within him, and that God had another plan for him instead of the one that he had for himself. I promised to do all of those things with tears falling down my face, both of us knowing that this was not going to end well, that death was likely going to occur in the near future, but refusing to say it or give up without a fight. As the team surrounded the patient preparing to intubate, I kept reassuring him to look at me, to stay focused on his spot and concentrate on me. I held his hand, squeezing tighter through the rising panic and increased struggle of breathing as we were starting to lay him down. As part of a controlled intubation, there is an eerie peace about the room. Everyone in there has a job, except for what felt like Jose and I. Everyone is focused, tempered in emotion, and preparing for the worst. Our hands were tightly clasped until all the medications had been administered, and then his hand went slack and started to let go. As I started to recirculate the blood back into my hand from his near-death grip on my hand prior to intubation, the physician thanked me for staying with him. I had felt a kinship with Jose and committed, or maybe determined, to see this all the way through whatever end was in store for him. I asked if he had family in the emergency department, and I was told his parents and fiance were on the way, but were not here yet. Jose ended up making his way upstairs to the ICU, and I helped transport him upstairs and help the ICU team settle him in. Over the course of the next few days, we made an exception for his next of kin to say goodbye. I had an opportunity to meet his mother and father in the hallway outside of his room. I took the time to introduce myself as the nurse manager of the emergency department and let them know the role the ER clinical team had played in his care. I told them all the things that I promised Jose that I would tell them, and held his mother fiercely as she collapsed in my arm, crying only the cries the mother of a dying child would. We knelt together in the middle of the ICU floor, with nurses offering to help us move, to get us up off the floor, or to get us into a more private space. We did none of those things, and I held her what felt like forever, but what was probably 10 minutes. In that moment, I felt all the fear Jose and I had. I felt all of our tears, all of our grief, and all of our pain. I apologized profusely for what I had no clue, but kept saying it over and over again. I am sorry, hoping those 3 words would somehow make it better. It has been years since my time doing pediatric trauma and critical care that I've held a parent consumed with grief, but those feelings never go away. It was like ripping off the scab of a partially healed wound over and over again. It burned, it ached, and it bled. But as the compartment I tucked Jose into was ripped open and laid bare, I cried for all the things that were lost on that day. The loss of a son, the loss of a young life, the loss of a connection to Jose that was cemented in a moment of empathy and grace. The moment I recognized a scared and dying child without a village and felt pulled to be on his team for however long we were destined to play together. Jose died on day 5 in the ICU with a team of amazing ICU nurses who fought like hell to keep this 28-year-old man alive. They were as devastated as I was, not only as parents themselves, but they were hoping to have one success story in the ICU during COVID. One win after having endured so many losses. I will always remember Jose and our immediate connection, our tiny little village of love and support, and my connection to his parents. I hope that I may be prepared for the next moment of futility and grace and allow myself to be present in that moment of need, full of compassion, support, understanding, and grace. Thank you.